Constipation. What actually helps? Many people think it's normal to struggle with bowel movements for years, feeling bloated, going days without pooping, straining every morning, depending on laxatives just to get relief. Even certain food and medications can slow the gut down dramatically. What really causes constipation, which foods and habits actually help, why some popular treatments fail, and the evidence-based strategies doctors use for chronic constipation. It's about restoring healthy gut function long-term. Constipation in some cases are temporary and related to lifestyle. Others are chronic and may be associated with digestive disorders, medications, or problems with bowel function itself. Worldwide, chronic constipation affects approximately 15% of the population. Many people make constipation worse without realizing it. Some foods and medications can trigger constipation. Certain medications may be slowing bowel movements, such as drugs containing opium or opioid-related compounds. Some processed low-fiber foods can also contribute to constipation. For example, white bread, heavily refined grains, and diets low in fruits and vegetables. Over time, low-fiber intake slows stool movement and reduces stool bulk, making bowel movements harder and less frequent. The solution is not just eat more fiber. Some constipation treatments work far better than others. The biggest mistake people make: most people immediately reach for stimulant laxatives. And while these can provide short-term relief, they often fail to solve the underlying problem. Some people end up trapped in a cycle of constipation, laxative use, temporary relief, and constipation again. What actually works long-term? Multi-component foods and fruit-based foods can significantly improve constipation symptoms. In fact, for increasing bowel movement frequency, fruit-based foods often perform better than standard fiber supplements. And regarding constipation severity, fruit-based foods may also be superior to fiber supplements alone. Certain foods appear especially helpful: kiwi fruit, prunes, rye bread, and fiber-rich fruits and vegetables. Why? Because many fruits provide fiber, water, natural sugars, and bioactive compounds that stimulate bowel activity naturally. This combination may work better than isolated fiber powders alone. But even if you increase fiber, constipation may continue if you ignore hydration and movement, because fiber without enough fluid can actually make constipation worse. And this is where many people sabotage themselves. The role of water, minerals, and exercise. Adequate fluid intake is essential for healthy stool consistency. Some studies suggest that mineral water rich in magnesium or bicarbonate may be especially helpful for chronic constipation. Magnesium helps draw water into the intestines and may improve stool passage. Physical activity also may play an important role. Lack of exercise is strongly associated with constipation because movement helps stimulate normal bowel function. That's why one of the most effective lifestyle combinations includes adequate hydration, regular exercise, high-fiber foods, and consistent fruit and vegetable intake. Probiotics and gut bacteria. Certain probiotic strains, especially bifidobacterium and lactobacillus, may help improve bowel regularity in some individuals. These bacteria may support gut motility, produce important substances, and improve the intestinal environment. However, not all probiotics work the same way, and results vary between individuals. When lifestyle changes aren't enough, sometimes lifestyle changes alone are not enough. In chronic constipation, medical therapy may be necessary. Doctors may use osmotic laxatives, stimulant laxatives, probiotics, prokinetics, secretagogues, bile acid transporter inhibitors, or other prescription medications. One of the most commonly used treatments is polyethylene glycol, also known as PEG. PEG-based preparations are considered effective for both short and long-term management of constipation. Other commonly used options include lactulose, senna, bisacodyl, sodium picosulfate, magnesium oxide, and psyllium supplements. Some newer medications, such as lubiprostone and serotonin receptor agonists like tegoserod, may also help certain patients with chronic constipation. But these treatments are not perfect. Common side effects may include bloating, abdominal pain, cramping, diarrhea, and nausea. Special cases, children and pelvic floor dysfunction. In children, constipation management often focuses heavily on behavior. Treatment may include toilet training, routine bathroom habits, dietary changes, and laxatives when necessary. Another important but often overlooked cause of constipation involves pelvic floor dysfunction. Some individuals have difficulty coordinating the abdominal and pelvic muscles needed for defecation. In these cases, biofeedback therapy may be beneficial. Here's the most important thing to remember. Constipation is usually not caused by one single problem. It's often the result of multiple factors working together. Low fiber intake, dehydration, inactivity, medications, poor bowel habits, or altered gut function. That's why long-term relief usually requires more than a quick fix. The goal is not simply to force a bowel movement today. The real goal is to restore healthy bowel function consistently over time. And in many cases, the most powerful treatments are surprisingly simple. More movement, more fluids, more fruits and vegetables, better daily habits, and evidence-based medical support when needed. Because when your gut works properly, your entire body feels better.